Depression, often referred to as major depressive disorder, MDD, is a mood disorder marked by a persistent feeling of sadness or a lack of interest in life. It can interfere with your ability to work, study, and enjoy everyday activities. Unlike ordinary ups and downs, depression is a long-lasting condition that can change the way you think, feel, and experience life. Depression manifests in several ways, and its symptoms can be grouped into four main categories: emotional, cognitive, physical, and behavioral. Emotional symptoms include persistent sadness or low mood by feeling down or empty most of the time, hopelessness and worthlessness by experiencing feelings of emptiness or believing you have no value, loss of interest, anhedonia, where losing enjoyment in activities that once brought pleasure. Cognitive symptoms include difficulty concentrating, such as struggling to focus or make decisions, negative thinking, like harsh self-criticism and a tendency to dwell on negative thoughts, suicidal ideation, where there is recurrent thoughts about death or suicide, physical symptoms like changes in appetite or weight, with noticeable weight gain or loss, sleep disturbances by experiencing insomnia or sleeping too much, fatigue where a constant feeling of tiredness or lack of energy, unexplained aches such as physical pains that do not improve with treatment. Behavioral symptoms include social withdrawal, such avoiding friends, family, and social activities, reduced work or school performance like struggling with responsibilities, neglect of self-care by failing to take care of personal needs or hygiene. In some cases, depression can be accompanied by psychotic feature, such as hallucination and delusions. These might be auditory, hearing voices, or visual, seeing things that aren't there, and are typically consistent with the person's depressive feelings. For example, someone might hear voices that reinforce negative beliefs about themselves. Mental health professionals use guidelines from the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, to diagnose depression. This process typically includes A. 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either 1. Depressed mood, or 2. Loss of interest or pleasure. Depressed mood most of the day, nearly every day, as indicated by either subjective report, feels sad, empty, hopeless. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting or weight gain. A change of more than 5% of body weight in a month. Insomnia or hypersomnia nearly every day. Psychomotor agitation or retardation nearly every day. It refers to a state of excessive, unintentional, and purposeless physical activity. They may feel restless, anxious, or emotionally overwhelmed, leading to involuntary movements like pacing, hand-wringing, tapping, or fidgeting. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt. Diminished ability to think or concentrate, or indecisiveness nearly every day. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Depression is usually the result of a mix of factors rather than a single cause. Common contributors include genetic factors. A family history of depression can increase your risk. Biological factors. Imbalances in brain chemicals, such as serotonin, dopamine, and norepinephrine, play a role. Environmental stressors. Traumatic or stressful events, like the loss of a loved one or financial troubles, can trigger depression. Psychological factors. Certain personality traits, like low self-esteem or dependency, can make some people more vulnerable. Medical conditions. Chronic illnesses or hormonal imbalances can also contribute to developing depression. The most important message is that depression is treatable. Here are some common approaches. Medications like antidepressants, such as selective serotonin, reuptake inhibitors, SSRIs, or serotonin norepinephrine. Reuptake inhibitors, SNRIs, help regulate mood. Psychotherapy, like cognitive behavioral therapy, CBT, helps change negative thought patterns. Other therapies like mindfulness-based therapies and supportive counseling can also be very effective. Family support is one of the most powerful protective factors against the negative effects of depression. By offering compassion, patience, and practical assistance, family members can significantly improve a loved one's well-being and recovery journey. In severe or treatment-resistant cases, treatments like electroconvulsive therapy, ECT, may be considered. For many, depression comes with the heavy burden of suicidal thoughts, which are serious and require immediate attention. If you or someone you know is experiencing these thoughts, here's what you can do. Take them seriously. Any mention of suicide should be treated as a clear sign that help is needed. Encourage professional help. For yourself, reach out to a trusted friend, family member, or mental health professional. For someone else, gently suggest they speak with a professional and offer to help find a therapist or accompany them if needed. Immediate crisis intervention. If there is immediate danger, call emergency services immediately. Provide emotional support. Listen without judgment and express genuine care. Validate their feelings. Acknowledge that their pain is real. Encourage them to stay connected with supportive people. Remember, if you or someone you care about is in immediate danger or is at risk of self-harm, please seek help immediately. Depression can feel overwhelming, but it is a condition that can be managed with the right support and treatment. Every step toward seeking help is a step toward healing. Whether it's reaching out to a friend, talking to a mental health professional, or simply taking time to care for yourself, know that you deserve to feel better. Recovery is possible, and you are not alone in this journey. If you're struggling, please consider seeking for help. Help is available, and there are many people and resources ready to support you through this challenging time. Your mental health matters. Always remember that.